Yo, yo, yo. What's going on, guys? It's your boy Physics. So, here's the drill, right? I have an exam tomorrow at my nursing school. It's an online exam, though. They proctor you and everything. But I'm really nervous. I feel like it's really hard for me to study on my own with all these distractions here, you know? Got the Xbox. I got the freaking internet, you know, at the tip of my fingers. There's just so much for me to do. YouTube videos, I just watch them constantly. Like right here, I'm watching freaking Joe Rogan. I'm like, you know what, dude, you gotta stop. You gotta freaking study for this thing. So the only way I feel like I can stop all these things is just stream. So that way I'm just focused here, you know? So this may not be your cup of tea, because I know I do a lot of sneaker stuff, gaming stuff, Pokemon card kind of thing. But I gotta do this right now, you know? So here, so my exam is going to be consisting of acid-base imbalances, glucose regulation, and gas exchange. So I'm on this little site here. This is how nursing students' tabs look, and this is just my PC. I'm mainly on my MacBook, and this thing is usually 30 plus tabs in. I can see them right now. They're madness. But yeah, let's start with this right here. Let's start with chapter 12, acid-base imbalances, right? So here you go. This might not be like entertaining at all, but if I have some nursing students out there or anything, let's do this. So question number 1. The nurse assesses a client with diabetes. Acid-base imbalance. The client has ABGs done. pH is 7.36. 7.36 is normal, because pH normal is 7.35 to 7.45, so 36 is within normal range. PaO2 98, which is normal range. Normal is 80 to 100, I believe. PaO2. Regular O2 is 90 to 100 or something like that. PaCO2 is 33, so that's slightly basic, because normal is 35 to 45. So if your CO2 is under 35, it's going to be basic. So that's slightly basic. Then we have bicarb at 18. So that's under the 22 to 26 normal. So this is definitely acidic. So what we have here is someone who's in normal pH with basic CO2 and acidic bicarb. What manifestation should the nurse identify as an example of the client's compensation mechanism? Okay, so here we go. So pH is basic, or what am I trying to say? Normal. The oxygen is good. Looks like the respirations would be good. But since that bicarb is very low, and its CO2 is actually alkaline, it seems like there's a problem with the kidneys, and since we're pretty close to being acidic in terms of pH, I feel like this is they're going to have metabolic acidosis. So in compensation of that, it's going to be respiratory alkalosis. So increased rate and depth of respirations for sure. That way it gets the, what's it called? Gets that up a little bit. Increase urinary output, nah. Increase urinary, no. It's definitely A. Yes. So the client has metabolic acidosis, because this is very low. This is pretty low. And yeah, to compensate for that, the respiratory system is going to breathe more, blow off some excess CO2, and it can compensate more, since the freaking kidneys aren't doing nothing. Okay. Yeah, I know I take a long time with these, but during the real exam, I have to freaking step it up. So the nurse is assessing a client who's experiencing an acid-base imbalance. Client's arterial ABGs are saying pH is 7.34, which is slightly acidic. PaO2 of 88, which is normal. PaCO2 of 38, which is normal. 35 to 45 is normal. And bicarb of 19, which is low, which is acidic. So you have acidic pH and acidic bicarb. And normal PCO2. So which assessment would you perform first? Cardiac rate and rhythm, skin, musculoskeletal, orientation. Well, since O2 is pretty good at 88, or PaO2, probably not this. Even though as metabolic acidosis worsens, yes, orientation is a problem. But since it's barely acidic at 3-4, this is all kind of barely acidic too. 22 is like the lowest normal range. I'm gonna go with cardiac rhythm. Boom, A, sweet. Early cardiovascular changes. Yeah, okay. Tight. And you see as acidosis worsens, heart rate decreases. EKG changes will be present, and then the CNS will change as it worsens. So in the beginning, you won't really see too much orientation stuff. Oh crap, what'd I do? Alright, I didn't see anything. Let's go. Okay. So a nurse is assessing a client who is prescribed with furosemide, Lasix for hypertension. For which acid-base imbalance should the nurse assess to prevent complications of this therapy? Now, furosemide is a loop diuretic, so you're going to be peeing a lot, right? The more you pee, the more you excrete hydrogen ions. So this is going to be a metabolic alkalosis. D, metabolic alkalosis. Yes, sir. Many diuretics, especially loop diuretics, increase the excretion of hydrogen ions, leading to excess acid loss. Very true. See, I'm pretty good at acid base, but when it comes to glucose and gas exchange, ouch. The nurse is assessing a client who is experiencing moderate metabolic alkalosis. Which action should the nurse take? So moderate metabolic alkalosis, so it's slightly worsening. Might be feeling some tingling. Or is that respiratory alkalosis? I think it's respiratory alkalosis. Well, let's see here. Moderate daily hemoglobin and hematocrit. Administer furosemide. Nah, heck no. You're already in alkalosis. Encourage the client to take deep breaths. Nope. Because I'm just going to add to the alkalosis. And teach the client fall prevention measures. Yes, because I believe metabolic alkalosis patients are pretty weak. I think it's due to the potassium and calcium being low. So D. Priority nursing care for the client is experiencing moderate metabolic alkalosis is safety, muscle weakness, risk of falling. Doesn't say that it's potassium and calcium, but I'm pretty sure it's because of that. Oh, damn it, I saw it. B. Damn, I know this one too. Kussmaul's, it's always metabolic acidosis. Acute pancreatitis. It's at risk. Acute pancreatitis, you'd be at risk for metabolic acidosis because what am I trying to say here? You have an underproduction of base. Since your pancreas isn't working as well, you're not going to be supplying enough bases, basically. Same with kidney disease, pancreatitis, anything damaging those two, you're going to have a decrease in base. So that means your acids are only going to go up, I believe. So then you're going to have Kussmaul respirations to try to compensate for that. So that's the B. So you see pancreas, major site of bicarb production through the underproduction of bicarb. Yep. lethargy, and small. I gotta remember that for the test. Manifestations of acidosis include lethargy and small respirations. For sure. Oh, I almost messed up. Okay. Number 6. The nurse assesses a client who is admitted with an acid-base imbalance. The ABGs are pH of 7.32. That's basic, alkaline. PaO2 of 85. PaO2 of 85 means still good. CO2 is 34. CO2 is 35 to 45, so this is low. Slightly basic. So they're acidic and basic, and then acidic for bicarb because it's lower than 22. So you have acidic, basic, acidic. So there's metabolic acidosis with compensation with respiratory acid alkalosis. Wait, crap. What am I trying to say here? Yeah, respiratory alkalosis. So what action should the nurse take first? Since they have metabolic acidosis, client's rate rhythm of respirations. No. Measure the client's pulse and blood pressure. Document findings and continue to monitor. Notify the physician as soon as possible. Shoot, why does this one seem so hard to me? Okay, so pH is acidic. Bicarb is acidic. CO2 is slightly alkaline. And then the O2 is 85. Shoot, I'm stuck here. I think you want to assess cardiovascular first. So I'm going to go with pulse and blood pressure. B. Freak. Progressive skeletal muscle weakness associated with increasing severity of acidosis. Muscle weakness can lead to severe respiratory insufficiency. Acidosis does not lead to dysrhythmias, but these would be best to assess with cardiac monitoring. Darn it. I mean, I guess that is cardiovascular too. I was... Oh, not really. I really thought it would be. Because I was thinking not this one because the PaCO2, the PaO2 seems kind of decent, I guess. So I'm thinking his breaths are alright. But okay. Damn. I got one wrong. Okay. Nurse is caring for a client who has the following ABGs. pH of 712. Damn. That chick is acidotic as heck. PaO2 of 56. Damn, that's low too. PaCO2 of 65. Super high. And then a bicarb of 22, which is normal. Which clinical situation should the nurse monitor correlate with these values? DKA in the person with emphysema. I mean, it seems like it. Because you're very... I don't know, because the bicarb is normal. I feel like this is just a huge problem with the lungs. And the kidneys have not compensated yet. So let's see, bronchial obstruction related to aspiration of a hot dog. Anxiety-induced hyperventilation. Well, that's a no because that would cause alkalosis. Diarrhea for 36 hours. And if that was true, bicarb would be way lower, I think. I'm gonna say B, bronchial obstruction, because that O2 is so damn low, that PCO2 is super high, and that freaking pH is low. So let's go with B. Yes, sir. Nice. 7B. Tight. Okay. A nurse is assessing a client who has experienced a 90-second tonic-clonic seizure. Seizures can cause metabolic acidosis, I believe, because of lactic acid buildup from anaerobic metabolism, I think. So let's continue. The client's arterial blood gas values are pH of 6.88. God dang. Super acidic. PaO2 of 50, acidic. PCO2 of 60, very acidic. And then PCO2 of 20, or HCO3 of 22. What actions should the nurse take first? So, respiratory acidosis, 100%. But then metabolic acidosis has to do with seizures mostly. Let's continue. Apply oxygen, most likely, because that oxygen is very low, that pH is very low. Apply a paper bag, hell no. No way. Too much CO2. Administer 50 milliliters of sodium bicarb intravenously. That might be an actual thing. I'm not sure about the dose, but I do know if patient's pH is under 7.25, you want to give bicarb intravenously. The glucose and insulin, I don't think so. But damn, that pH is so low, it's throwing me off. It's either A or C. This is an acute thing, I think, because they had a 90-second seizure. It just happened. There's no way the kidneys are going to kick in time to compensate. Damn, dude. 50 milliliters of sodium bicarb. Why does 50 milliliters seem so much to me? But I may be right, I don't freaking know. Yo, fine. Let's go with, I'm gonna go with my gut, because I learned this specifically today. To administer bicarb when a patient's pH is under 7.25 or something like that. But that's not priority, actually. ABGs, right? Airway, breathing, circulation. I don't know why I blanked out there. Let's go with A, because they need the oxygen big time. Yeah, tight. I don't know what I was thinking. This is more of like a treatment, I think. But this is like priority. Like, this guy needs freaking oxygen ASAP. This and this freaking scare me. But tight, we got it. Okay. At teaching a client who is malnourished is being discharged, a nurse assesses the client's understanding. Which statement indicates that the client correctly understood teaching to decrease risk for development of metabolic acidosis? I will drink at least 3 glasses of milk each day. Heck no. You want to avoid dairy if you have metabolic acidosis. I will eat 3 well-balanced meals and a snack daily. It's kind of vague, but we'll see. I will not take pain meds and antihistamines together. I will avoid salting my food when cooking and during meals. I don't know why this one has me stumped. So I know metabolic acidosis, you want to have no dairy, no tomatoes, a bland diet, no toast, bananas, saltine crackers. Saltine, that's key. That's salt. So D, avoiding salt. I don't know, because saltine crackers have salt. And then you also want a low residue, low fiber diet. So A for sure is gone, I think. 3 well-balanced meals and a snack. I'll not take pain meds and antihistamines together. Yeah, I'm gonna say the pain meds. Because pain meds and antihistamines, I feel like, could be damaging to the already compromised kidneys and such, liver. So C? B? Freak? Starvation or on a diet with too few carbohydrates can lead to metabolic acidosis by forcing cells to switch to using fats. Insufficient calories from... Man, this was kind of tough. I just felt like that was too vague. I feel like if it had more information in it. And then... Oh! See, I didn't read correctly. Malnourished, metabolic acidosis. Malnourished, you could assume, is starvation. So of course, make this guy eat. Damn it, I didn't read it right. I'm still learning how to think like a nurse, guys. This is pretty freaking tough. Crap. Okay. Nurse evaluates the ABGs. pH is 7.48. That's alkaline. Basic. PaO2 of 98. Pretty good. CO2 of 28. That's low. So that means it's going to be alkaline. So you have pH and CO2 on the alkalosis side. And then bicarb is normal. So which condition client should the nurse correlate with these results? So if pH and CO2 are both alkalytic, we're going to be talking about respiratory alkalosis. So diarrhea, vomiting, anxiety-induced hyperventilation. Yes, that's B. COPD would bring the pH down, and then DK emphysema would bring the pH down. So yeah, B. Final answer. Final answer. Elevated pH indicates alkalosis. Bicarb is level. Loss of carbon dioxide is the cause of alkalosis. And it occurs in hyperventilation. We got this. Okay. After providing discharge teaching, the nurse assesses the client's understanding regarding increased risk for metabolic alkalosis, which statement indicates the client's needs for additional teaching. So for metabolic alkalosis, risk. I don't drink milk because it gives me gas and diarrhea. Hold on. So the client's understanding regarding increased risk for metabolic alkalosis. Okay. So diarrhea would actually make you acidotic. Because you're... Yes. Because you're pooping out bases. So no. I have been taking digoxin every day for the past 15 years. Damn, that's so much. I take sodium bicarb after every meal to prevent heartburn. In hot weather, I sweat so much that I drink 6 glasses of water. Each day. Each day ain't bad. I feel like that'd be decent. If it said like at once, okay, that's pretty crazy. I want to say C, because one of the causes for metabolic alkalosis is intaking too much base, so taking too many antacids. That's I'm assuming that's what sodium bicarb is, like when she takes it. So let's go with C. See what happens. Tight. Excessive oral ingestion of bicarb or other bases. There you go. Can cause metabolic alkalosis. Bro, we getting this. Oh crap, no, it's either B or D. Crap. A nurse is caring for a client who's experiencing excessive diarrhea. Here we go. If you're excessive diarrhea, metabolic acidosis. The client's arterial blood gases are 7.28. Acidotic. Here we go. PaO2 of 98. Solid. PaCO2 of 45, high, normal, and then bicarb of 16, so that's very low, that's acidotic. So you have acidotic pH, acidotic bicarb, normal CO2, metabolic acidosis with no compensation. Which provider order should the nurse expect to receive? I mean, it's not what I learned. I learned to give this when the patient's at 7.25 and lower. But you're not going to give furosemide. Or maybe you might. Because it means you're going to pee out hydrogen. Shoot. Mechanical ventilation. Nah, PaO2 is solid. Indwelling urinary catheter. Doesn't say anything about it. Okay, well here we go. So this is I'm gonna go with B. Because you do want to give them some bicarb because it's very low. They're having excessive diarrhea, so you need to replace that base. And since they are in excessive diarrhea, you just want to give them that extra fluid to put that fluid back in their system. And maybe there's some, D5W, some glucose in there too, because they've been having all this diarrhea. So yeah, I'm gonna go with B. Tight. Let's go. Nice, okay. Alright. If this was my real exam, I'd be so happy. But the way my freaking professor makes the exams, oh my gosh, they're so frustrating and hard. Nurse evaluates a client's ABGs. pH 7.30, acidotic. PaO2 of 86, decent. PaCO2 of 55, this is elevated, so acidic. So pH and CO2 is acidic. So right away we're looking at, I think we're looking at respiratory acidosis. And then bicarb of 22, which is uncompensated. Which intervention should the nurse implement first? Assess airway, administer bronchodilators, provide oxygen, administer prescribed mucolytics. Dan, these are all related to it, but we're talking about what to do first. Because these would all be things that you would do. Because this person might be going through an anxiety attack, asthma attack, which is making it hard to breathe, so you're getting less oxygen in. If you prescribe those bronchodilators, you're going to get more O2, you're going to excrete more CO2, that's going to go down, pH is going to go up, all this stuff. Oxygen, if you give them oxygen, again, O2 is going to go up, pH is going to go up, CO2 is going to go down. But I'm going to go with my gut, which is A. Assess airway. Because as always, you want to assess your patient first. You want to find the underlying cause of what's going on with the patient. A. Boom, baby. Let's go. All interventions are important. You see, all these are important. However, the priority is assessing and maintaining an airway. Without a patent airway, other interventions will not be helpful. Well, duh. Tight. Okay. We're doing well. We only got one wrong out of 13. Solid A. Okay. The nurse is caring for a patient who is hyperventilating. Right away. Hyperventilation, respiratory alkalosis is what goes through my mind. The client's ABGs are 7.30, which is acidotic, actually. Okay, this might be metabolic acidosis because they're going through Kussmaul breathing. O2 is 94, so they have good oxygen. Nice. CO2 of 31. This is under 35, so this is basic. And then you have HCO3 of 26, which is high, normal, which is kind of almost basic. So acidotic. Yo, what's going on here? Which question should the nurse ask when developing the plan of care? Do you take any over-counter medications? You appear anxious. What is causing your distress? Do you have a history of anxiety attacks? You're breathing fast. Is this causing you to feel lightheaded? Yeah, this one got hard out of nowhere. So hyperventilating can be from Well, Kussmaul breathing isn't really hyperventilating in a way. It's just, I guess it is. It's a compensation for metabolic acidosis. But you usually hear hyperventilation in respiratory alkalosis. But this is obviously a pH of 7.3, so this is acidotic. Carbon dioxide is basic because it's under 35. Well, I need to do this little chart here. So base, or pH is acidic. CO2, basic. And then that HCO3 is normal, but high normal. So we could say, yo, I don't know what the frick's going on here. Hyperventilating, pH is low, metabolic alkalosis. I have no clue. I'm gonna go with D. Because that way you're monitoring orientation, safety, levels of cognition. So D. B. You appear anxious. What is causing your distress? That's true. Always assess the underlying cause. What's going on here? What are we doing here? Duh. I mean, I had a good reason for this, but you want to assess the patient first before you do anything. Yeah, you see? You can calm them down. Okay, yeah. Damn. Just as I said, only one wrong. Pain. Okay. A nurse is caring for a client who has chronic emphysema and is receiving oxygen therapy at 6 liters per minute via nasal cannula. The following clinical data are available. pH of 7.28, very acidic. Pulse of 96, it's high normal. O2 is 85, PaO2 is 85, just good. Blood pressure 135 over 45. That diastolic though. CO2 is 55, respiratory rate 6 breaths per minute. Dang, that's low. Body carb of 26, oxygen of 88. Jeez. It is chronic emphysema though. You can say chronic COPD. So that might 6 liters of nasal cannula is pretty high for someone with COPD. But let's see what's going on here. Which action should the nurse take? Notify rapid response team or provide ventilation support. Change the nasal cannula to a mask. I feel like that's what I would do. Because damn, those breaths are very low. Place the client in fallish position. Yeah, I feel like they should have been in that position. Decrease the flow rate of oxygen to 2 to 4 liters and reassess. Shoot. I'm gonna go with B. I feel like that's too much for nasal cannula at that rate and at that 88. A mask would help. I don't know, let's go. Freak. Shoot. Yeah, that makes sense actually. Damn it. I did learn in class though that there's a certain range of nasal cannula and then you just say, freak that, let's give this person a mask. A Venturi mask. But that's right. I mean, if the person is crashing, like if their vital signs are drastically changing, especially respiratory wise, rapid response. Damn. Ooh, status. I freaking. Oh, whoops! I just gave. I just gave it away. Alright, let's find the interventions that to regulate acid-base balance to ensure that the pH of a client's blood remains within normal range. Which abnormal physiologic functions may they occur if the client experiences an acid-base imbalance? Reduction of function of hormones, blood or fluid and electrolyte imbalances, for sure. Increase in the function of selected enzymes. Maybe. I already forgot the freaking answers. Excitable cardiac muscle membranes. It depends. Increased effectiveness of many drugs. Which abnormal physiologic functions may occur if the client? So I feel like drugs would decrease. Dang it, what were the answers to this? Increase in effectiveness of drugs. I mean, that might be true because if the kidneys aren't filtering too much, the freaking drugs are going to be in your system for longer. I don't think enzymes would have more function. If anything, they would denature through imbalances. B. BDE, because I know some imbalances can cause cardiac dysrhythmias. So BDE. ABE. Reduction of function of hormones. Reduction of function of hormones, fluid and electrolyte imbalances, increase in effectiveness of drugs. Okay. Man, I hate SATs so much. I don't want to give away the freaking... okay. Hopefully that's it. Okay, the nurse is assessing a client with ABGs of 7.32, acidotic, O2 of 94, decent, CO2 of 34, slightly below normal. So this is alkalotic. And then bicarb of 18, which is very low. So that's acidotic. So pH acid, bicarb acid, CO2 basic. Barely basic. So metabolic acidosis with seemingly some respiratory acidosis, alkalosis compensation. For which clinical manifestations? So for metabolic acidosis, reduced the tendon reflexes, drowsiness. I would say drowsiness because it kind of goes with lethargy. Increased respiratory rate. I mean, yes, because of the compensation from the lungs, but I don't know. Decreased urinary output. Shoot. Yes, I think. Positive Trousseau sign. Damn, I hate Seto so much, dude. Like, I feel like all these other ones I got right so well. Beasted them. And then it comes to these, I'm like, geez, man. Okay. So kind of like hyperreflexia is what they're saying. Like reduced hyperreflexia. Metabolic acidosis. Oh, shoot. I think it's true. Because I think it's an alkalosis that you get the hyperreflexia. So I'm going to go with A, B, and C. Decreased urinary output. I feel like that would be true too. Because your kidneys aren't working. Damn it. Can I see my notes, please? Freak it. Whatever. we'll learn this way, right? Through being wrong. So I'm gonna say ABD actually. C is more of a compensation. It's not really clinical manifestation. It's more of a indirect thing. But the rest of these A, C, D directly come from metabolic acidosis. ABD? Free. ABC. So I was right the first time. Shoot. Okay, so let me see, hold on. These clients usually are lethargic and drowsy. Exactly, metabolic acidosis does that. The respiratory system will try to compensate. You see, I knew that, but I thought it was because the compensation. Decreased urinary output's not even a freaking thing for this. Damn it. Oh wait, it's not, you're right. Damn, okay, no, it just hit me. Oh. That was an easy one. I thought I gave up. Come on, dude. Get your stuff together. Okay. So nurse is assessing a client who's at risk for acid-base imbalance. Which clients are correctly paired with the acid-base imbalance? Let's go. Metabolic alkalosis. Young adult who's prescribed IV morphine sulfate for pain. Metabolic alkalosis. I don't think so. Metabolic alkalosis. Older adult who is following a carbohydrate-free diet. I think that's true. Because the breakdown of carbohydrates makes hydrogen ions, I believe. So I think that's correct. Respiratory alkalosis, client on mechanical ventilator at a rate of 28 breaths per minute. I mean, I guess. Yeah, let's go with that. Because if you're breathing too much because you're respiratory alkalosis, your breaths are going to be super high. So, yeah. Respiratory acidosis, post-op care. Client who received 6 units of packed blood. Okay. Shoot, this is a hard one. I want to say blood transfusion does not cause acidosis. I don't want to cheat, man, but blood transfusions, where were we? Yeah, you see, blood transfusions are a cause for metabolic alkalosis. So I'm gonna say no to D for sure. And then metabolic alkalosis, older client prescribed antacids for gastroesophageal reflux disease. So if you're gonna have excess bases going in you, you might become metabolic alkalosis. True. Okay, so I'm gonna go with B, C, E. Drum roll, please. B, C, E. Let's go. Okay, so it's B because, of course, like I said, carbohydrates. The breakdown of carbohydrates produces hydrogen ions, so you'll be in acidotic state. C because if you're in a mechanical ventilator and you're at 28 breaths per minute, you're hyperventilating. You're going to be in respiratory alkalosis. And then E because antacids are a base. If you have too much base in you, you might become metabolic alkalosis. So, tight. Let's continue. Nurse assesses a client who is receiving total parenteral nutrition, TPN, which adverse effects related to the acid-base imbalance the nurse assess. Okay, TPN. What the heck do you cause again? What does TPN freaking cause? Does it cause alkalosis or acidosis? Shoot. I should know this. I just studied this. Does it cause metabolic alkalosis? I think it does. Dude, I'm stuck on this one. Shoot. Because it's not going to be anything with respiratory, so... Man, I'm stumped. Hold up. Let's see here. Let me get my little cheat notes. I shouldn't cheat, but... Bro, like... TPN, right? Okay, TPN, yeah, so alkalosis, metabolic alkalosis can cause an increase in base. So you'll see tremors, cramps, tetany, paresthesia, nausea, vomiting, anxiety, decrease in potassium, decrease in calcium, dizziness, irritability, decreased depth and rate of respirations, respiratory failure, hypotension, dysrhythmias. Increased heart rate. So it's not bradycardia. Elevated blood pressure. Sure. It's hypotension. Yo, this one's freaking hard, dude. What the heck? Damn, I just realized you guys can't really see this crap. Geez, this one's freaking tough, dude. What just happened? Okay, yo, I'm kind of lost on this one. I don't think you would have positive Chvaltics, whatever it's called. I'm pretty sure that's respiratory alkalosis, elevated blood pressure, bradycardia. I'm gonna go with anxiety and all I have is anxiety. I'm sorry. I swear to God, if it's freaking... Let's see. A&E. It's Chvaltics. So this person's on TPN, which can cause metabolic alkalosis. So both alkalosis, respiratory and metabolic, cause Chvaltics? Hold up. I need to research that really quick. Chvaltics sign and metabolic and respiratory. It's not acidosis. It's alkalosis. Oh. Freaking butchered that. Respiratory alkalosis causes hyperinflation. I know it's a respiratory alkalosis that causes the trousseau and the Chvaltics. I don't know how to say that one. But I did not know metabolic caused it. Okay, there it is. Oh, my professor didn't teach us that. They taught us the tetany for sure. for metabolic. Okay, well, there's that. Okay, a nurse is planning for care for a client who is anxious and irritable. The client's ABGs are 7.30, so that's basic, or sorry, acidotic. So that bad boy's acidotic. O2 96, you're decent. CO2 43. No, equal. That's solid. It's between 35 and 45, so you're set. And bicarb is at 19, so that's under 22, which is normal. So we're talking acidotic here. So pH acid, HCO3 acid, metabolic acidosis with no compensation. Which question should the nurse ask? You were taking any antacid medications? I think so. Oh, let's select all that plat, my bad. So yeah, that one's for sure. Is your spouse's current behavior typical? I guess. Do you drink any alcoholic beverages? Alcohol can cause metabolic alkalosis, I'm pretty sure, or acidosis. Yeah, because it's ingesting acids. Have you experienced any vomiting? Vomiting would decrease acids in the body. I don't think so. But at the same time, DKA does have some vomiting up in there. Are you experiencing any shortness of breath? Bro, man. I hate SATAs. Let's go with A, B, C. ABC. Wreck my soul. BC. Are you taking any antacids? Why is this wrong? What did I do wrong here? Why did I get that one wrong? What are we doing here? Are you serious? Does it? Hold up. Antacids. Base. You're ingesting too much base, so that'll make you alkalotic. Yeah. Duh. Darn. So it is BC. I freaked up. I don't know why I thought this would make you acidotic. I was not thinking. Damn it. Oh, and that's it. Alright, overall I think we missed 4 out of what do we have here? 15 plus 5 of these. It's 20. Oh, that's not too hot. 16 out of 20. Still passing, but could have done better. Alright, damn. So that's my acid and base. Freaking test bank here. I did pretty well. I still have freaking this other acid-based one, diabetes, and glucose regulation. Jesus. It's 12:11. Alright, no. I think I'm gonna go offline now. Whoever was here, thanks for watching, but I need to go eat a snack because I'm freaking starving. I have my exam in exactly 11 hours. Yeah, exactly 11 hours. Damn, I'm so freaking nervous, dude. There's so much to this freaking exam. Like, based off this little exam here, I did pretty well with my acid and base. Some little mistakes here and there, but I feel like I can clean that up. Damn. Nursing school, yo. When I first started nursing school, I'm not gonna lie, I'm like, man, this ain't nothing. Like, I always thought it was just all talk, you know? Like, people always say nursing school is hard, but I bet you it's nothing. Because same thing with, like, when I took microbiology or anatomy and physiology, people are always like, I failed it, it's so hard, I don't know what I'm doing. And then I take it, and I'm like, well, I got a pretty good grade. Like, I don't see what was so hard about it. So, but nursing school, jeez, they weren't lying about that one. There's so much to it, and you have to learn so much in such a small period. And just the fact that you're gonna be using this out in the field, saving lives, and you really gotta know your stuff. So every time I get a freaking question wrong, I'm like, 8 out of 10. 8 out of 10 is like an inside joke with me and one of my classmates. Because like in the first, one of our first classes for nursing school, we were learning how like, we had like a quiz. And like how 80% is passing, right, for nursing school. And then one of our teachers was like, average score was like an 80%, and we're like, hey, 80, 8 out of 10 patients survive. And then from there it was just a thing. It's like 8 out of 10 kind of thing. It's not funny because 2 patients died, but it's, you know, it's a little inside joke. But yeah, nursing school's freaking tough. I do watch so many videos on YouTube. There's so many good people out there. I love that freaking Simple Nursing guy. Shout out to you. Probably not watching this, but his videos are really entertaining, really in depth, and they get you like immersed. So that's a good way for me to learn right now. Probably gonna watch some of his videos right now on acid base, glucose regulation, gas exchange. Because I need to catch up on some ARDS stuff, acute respiratory distress syndrome. Like, I'm kind of trash at that right now, but we'll see. I'll be up for another 2-3 hours and I'm gonna knock out because I need some sleep for this exam. So yeah, like I said, man, if you guys stuck around and enjoyed this, cool. Any nursing people out there, shout out to y'all. I hope you guys did just as well on this as I did. I didn't do crazy great, but we did pretty well. But anyway, have a good night, guys. It's been your boy Physics. Peace out. Let me just freaking go to OBS here.